Hello and namaste. So today when someone gets back pain, stiffness, fatigue or any new symptoms, many people do not call their doctors first. They open ChatGPT and they type, is this my ankylosing spondylitis? Should I exercise today? Or should I stop my medication? Or does this MRI mean that my disease is, becoming bad or worse? So the question is not whether people are using ChatGPT or other AI for ankylosing spondylitis or not. They are already doing that. The important question is, should you trust AI to help you, or when should you stop typing and go to your doctor and listen to your healthcare professional? So let us look at some of the usefulness of AI, and then I'll be also talking about what are those use cases where AI is not useful for you. So AI is good for education. And what is a pelvis joint? How does the pelvis joint move? What is the difference between ankylosing spondylitis and rheumatoid arthritis and axial spondyloarthritis? And when can my disease become worse? Or what is biologics and what is the TNF inhibitors? So these are good questions that you can ask AI. Now, you can even ask AI by saying that, please explain to me like a 15-year-old, because AI can make it very, very complicated for you, especially if it is medical terminology. So you can ask AI to make it very simple for you and explain it like a 15-year-old. So understanding your disease and understanding about the symptoms, developing a knowledge about your disease is where AI is really helpful. The second use is that AI can also help you to prepare for your doctor visits. You can ask AI, when your symptoms have become worse, help me prepare to discuss my symptoms with the doctors. Now you should ask in a prompt in a very elaborate way how much your sleep has changed, what is the symptoms that have changed, what is the level of your stiffness, is exercise really helping you. So give as much as detail to AI as possible so that it can give you a better answer. So it helps you to have a better communication with your doctor and prepare for that communication. Okay, so that's the second use. Now the third use is that AI can help you to recognize your patterns, okay, your health patterns. Now you can use AI as a recording tool. So you can record, today my morning stiffness was for 45 minutes, the pain was 6 out of 10, I was able to walk for 5 kilometers, or my sleep was poor, my stress level was high. So you can give the entire recording of every day, and then at the end of 1 month you can ask AI to corroborate all the data and give you a nice summary of what are the patterns that you are having in your disease. However, you should understand that finding a pattern is not same as doing diagnosis. Okay, so diagnosis is very different. In fact, diagnosis is the cause of the pattern, okay, and patterns are what are actually happening in your life. Now AI can also help you to explore lifestyle options. Now what is the sort of desk that I should have, what are the options for a good ergonomic chair, or how should I gradually increase my walking? These are some things that you can ask AI, and AI can give you ideas. It's very important to understand the distinction here. Okay, so AI can give you very good ideas, AI can give you knowledge, but a physiotherapist, someone like me, or a healthcare professional who has assessed your body can tell you whether these ideas will really work on you or not, and whether they are really appropriate for you. Let us look at few use cases where AI is not useful. So let's start with the first one. You should not be asking for AI to diagnose you. So for example, you should not be asking, I have back pain, morning stiffness, fatigue, do I have ankylosing spondylitis? Now, AI may not be able to explain everything to you. Okay, it cannot, because it cannot examine you, it cannot assess your movement, it cannot evaluate your spine, it cannot evaluate your medical history, it does not have access to your blood work. So asking these kind of things like, could these symptoms be AS, or tell me definitely whether I have AS or not, is very, very dangerous. Instead of asking this, you should be asking, what are the symptoms that I should be discussing with my doctor? Apart from the ones that you're observing, what are the other things that I should be discussing with my doctor? And you should go ahead and discuss that and prepare for your medical visit. Now, another thing that AI that people are using and which is very, very dangerous for you is changing your medication. Now, sometimes people just write that my biologics is not working and should I stop taking it? Now, asking this kind of question is very, very dangerous. Should I double my dosage of anti-inflammatory medication, or which biologic should I change to? So AI can explain about a medicine, but AI cannot explain what is the dosage, what is the frequency with which it should be taken, and whether you should be changing it, because it doesn't have access to your medical history. It doesn't have access to your infections. It does not know the interactions between medications and any other previous treatment that you have taken. It does not know about your spinal mobility. So these are big concerns which a doctor thinks about it, or someone like a qualified physiotherapist like me. We discuss this, and then we come out with what is to be done as a next step. The next thing is, don't use AI to explain red flag symptoms. Now, for example, suddenly if your eye becomes red and is painful, is this because of AS? Now, you can then go ahead and then start to talk with AI for next 2 hours about the eye redness, or uveitis, or complications in my eye, or blurred visions, so on and so forth. Now, this is just delaying your immediate attention. What you should be doing is immediately going to the doctor, immediately going to an eye specialist or an ophthalmologist, and discuss about your blurry vision and discuss about your eye. Do not discuss this with AI, because AI cannot give you a good answer. At the end of it, the simple rule is that if you want to understand, organize, prepare, and ask better questions with your doctor, then you should be using AI. But don't use AI for diagnosis, prescriptions, changing medication, or any other serious symptoms. So think of AI as a very knowledgeable assistant that is sitting next to you. It can help you understand information. It can organize your thoughts. It can even help you to ask excellent questions, but it cannot examine your body. It does not know everything about your medical history. It does not know what is your posture, what is the level of flexibility that you have. So it's very important to have this distinction. And also, lastly, AI can be sometimes confidently be wrong. It will confidently say, oh, this is this, but it is completely wrong. So even OpenAI, the parent company of ChatGPT, advises people to seek healthcare professionals, doctors, in case to get a medical advice. Otherwise, you will just be delaying your health. And it's not that AI is your doctor. No, it is AI, you, your doctor, and other specialists, your physiotherapist, that combine together to improve your health. It cannot be just AI and you. Don't do that. Okay, in the end, I would want to ask you, have you ever asked ChatGPT a question about your AS? Did you find the answer helpful? If you found this video useful, then please share this video with your friends, with your other people, and spread it in the network. I share a lot of information about ankylosing spondylitis, chronic pain, posture, movement, and strategies for living a more active life. Till the next video, live a healthy life, and all the best to you.